Good afternoon. How are you all today? You're all okay? Excellent. What we're going to do this afternoon is to just try to kind of introduce a few little ideas for you with respect to I guess approaching perhaps some of the more difficult conversations with some of our patients. So we'll be drawing on the use of motivational interviewing. Today's not kind of the full gamut with motivational interviewing and how to do it, but more just picking up little pieces of that in terms of making perhaps some of those difficult conversations a little more easier and certainly trying to make sure we address these certain topics. Now, in the spirit of what Kevin was just saying, it is going to be a bunch of little kind of exercises and stuff today that we're going to do. What I'm going to start off with, in actual fact, is I'm just going to ask you to please close your eyes. This is voluntary, so you don't have to close your eyes, but if you wouldn't mind closing your eyes. And what I'd like you to do with your eyes closed is just to imagine you're sitting in your office or an interview room with a patient about your own age who's recently had a stroke. The patient is clearly affected by the stroke with impairment to one side of the body and difficulty speaking. There may also be cognitive impairment at some level. They appear physically fragile and also emotionally. They seem both scared and angry at the same time. They're not making a lot of eye contact, except maybe when they're kind of having to raise their voice at you. You know their life is changed forever, and you know there are many things they'll need to do to get the full benefit from rehabilitation, as well as cope with their new life and all the challenges it will involve. Just have a think for a moment, with your eyes closed. What do you think the patient is going to need to do in their life? What do you suspect their treatment or rehabilitation priorities are? And how might you convince them of these priorities? Just have a little brief think about those three questions for a moment. If everyone could just open your eyes now and just turn to the person next to you or the couple of people next to you, just have a little bit of a conversation. What thoughts came to mind for you, being able to see that person there and these questions of, up on the board, what do you think they're going to need to do? What do you suspect their treatment priorities are, and how might you convince them of those things? Just have a bit of a conversation about that for a couple of minutes. I might wrap that one up there. Lots of interesting discussion going on. What are your thoughts? Any particular thoughts about this person in your mind, what they're going to need to do, their priorities, how you might convince them of that? Any thoughts? They what, sorry?
They just want to get home.
Often their priority is about getting home. Yeah. And that may or may not exactly fit with what we might actually kind of think for them sometimes. Yeah? Okay, that's interesting. Any other thoughts?
We were thinking more acceptance of what's happened to them would be difficult.
Yeah. So part of that is how, to give them some sort of space to think about those issues, which aren't really about doing something or kind of whatever, but more about just thinking it through.
I had personal experience of a sister. My sister had a stroke at 52 and she eventually died, and she was on renal dialysis. So the conversations that we had together were more about how to live a normal life again, how to escape, how to go on a holiday. So it was, a lot was, we sort of talked about those sort of things.
And it sounds
how
like...
to have a normal life,
And it sounds like she was the one that was trying to define that for you in those conversations.
Even in hospital, it was like, let's take the bed downstairs, get outside, like how to just have these moments of freedom, it felt like,
Good.
Away from machines and dialysis.
Yep, okay, great, thanks. Good. Was there someone else over here?
You just talked about their roles, which might be financial roles or social roles, and how they were going to try and be themselves in those roles. And that might depend a little bit on where you were in your life. So what I might be thinking about a person my age might be a bit different to what other people thought about people their ages.
Yes, and isn't it interesting that actually the potential priorities are sort of many and varied, and there is this piece about whether our sort of assumption of what those priorities might be for this person may differ from what theirs actually are. And so reconciling that piece is probably our first challenge in a way as the clinician. So how do you think the patient's feeling in this moment there in the session? What are some of the feelings that you suspect might be there? Feeling overwhelmed, feeling fearful, afraid, angry, sad.
They might be motivated.
They could be motivated.
Motivated to be independent again, and they just madly want to do whatever they can to get there.
There might be something, if we can discover it, that actually does give them that buoyancy. Yeah. They might on the one hand be sad and fearful, on the other hand also somewhere there's also some sort of motivation. How are you feeling in that moment as the clinician? What sorts of feelings do you notice within yourself?
Anxiety.
Some anxiety too.
Maybe empathy and putting yourself in their shoes and saying, oh, if it was me.
Yeah. Yeah, sort of empathy almost to the point of, you know, kind of really feeling some sort of sympathy for them and their position, and anxiety because I really want to help this person. I really want to do something to kind of, well, maybe not fix it, but at least, you know, make things a lot better for them. Any other thoughts about how you would be feeling there?
Gratitude that it wasn't me.
Some gratitude, in fact, that it wasn't you. Yeah. And a kind of a little heads up about our own lives and the importance of our here and now, because things can change. It's interesting.
Uncomfortable because you know some of the things you might have to broach. How do you go about that?
Yes, okay, great. So there are topics that are difficult to broach, and we're sort of humans. You know, like Matt was talking before about sex and people in their 80s or whatever, and we all sort of nervously giggled sort of thing, because some of these topics are kind of a bit uncomfortable, and there are many others as well. So there's some discomfort potentially to have to address that. Okay. If you wouldn't mind just closing your eyes again. Because now it is time to reverse the roles. You are the patient who's recently had a stroke, and you're sitting in an interview room with a clinician about your own age. You know the stroke has affected you, and you feel scared and angry about what has happened. You're faced with the prospect that your life has changed forever, and you can barely fathom all that you'll need to do to get the full benefit from rehabilitation, as well as cope with your new life and all the challenges it will involve. Have a little bit of a think about the following questions. What do you as the patient need from the clinician right now? How would you feel about the clinician trying to convince you of what you should do? How might you end up kind of trying to convince them back of your own priorities? And what might you do if you weren't feeling properly heard and understood? Just have a think about that for a moment with your eyes closed. All right, just open your eyes and maybe have another chat to the person next to you about this topic now, this idea of being in the patient's chair. Off you go, just for a couple of minutes. What comes up for you there? What do you notice when you sort of really kind of sitting in that patient, a little bit like what you said, that sense of empathy for what that would be like? What comes to mind with that?
I want complete honesty.
Okay.
No beating around the bush for awkward topics. I want to know exactly where I was and where I was going to be going in the future.
Ah. And isn't that interesting? Because I think people vary, but definitely some people want that. They want the honesty, they want the detail, they want to know the facts about the facts of the matter and that sort of stuff. And so we don't want to just assume that we need to kind of protect them from that or anything like that. We want to check in with them and find out what's right for them. So that's great.
I have got one of two ways. I think with some prior knowledge of medical whatever, whether you stroke knowledge or anything else, you could go right to that line. I know what's best for me, I'm just going to tell you. And
Yep.
God help me if you give it to me.
Yeah.
Or you could suddenly be taken over by passivity, just become completely passive
Oh.
and go into a sick role and want everyone to do everything for you.
Yeah.
Nothing in between.
What's that?
Probably nothing in between.
Maybe, yeah. Some people are really wanting to advocate for themselves and what's right for them and where they want to take this thing. Other people kind of almost are ready to let go of any of that and just hand over the responsibility for that. Interestingly, in a funny sort of way for clinicians, both of those responses we still want to somehow evoke, their own goals, their own actions, their own commitment and motivation. So even for the passive ones, we still often want to do it that way. Other thoughts?
I'd want them to have a bit of a balance between acknowledging and providing with the facts, but also acknowledging my feelings. So
Yeah.
I don't want them to go too far in either direction. Like, you can't just focus on the feelings to a degree, and you do want the facts, but I think I want one without the other.
Yes.
And I don't want to be overwhelmed with too much information at the beginning.
Yes.
Even though I know I need to know it, I might just,
Yeah.
it needs to be in user-friendly chunks.
Yeah. And I think that's the responsibility of the clinician, isn't it? Is to be able to put stuff into plain language. Our task really is to be able to communicate in a way where they can have the information and sort of understand it and hold it at once, rather than just not giving it to them because it's too difficult to understand or something like that. But I don't know if you've heard this one before, but the facts and the feelings type thing, it's a little bit like, you know, the lyrics without the music, or the music without the lyrics. You know, neither are really a complete song. Excuse me. One, you know, if we just give them the facts, that's like just someone singing without any backup. You know, and if we just sit there feeling, then it can seem like it's going around and around in circles. We want a little bit of both in these sort of conversations. Any other thoughts?
Trust. You want to be able to trust the clinician. You want to be able to develop some sort of sense of rapport.
Yeah.
Because you're going to need them for hope and sustainability.
Yep. Yep.
You want to feel secure.
Yep. There's something very key in the relationship itself, trust being a really important piece to that. You kind of need to feel safe in that conversation first before really it can go anywhere. And part of that is to have that sense of feeling heard and understood. How would you feel, I guess you've kind of mentioned this, but how would you feel about them keeping some information about you or about your condition from you? How would you feel about that?
It's how aware you are.
How what, sorry?
How aware you are, because obviously all that stroke
Of course, yeah. As Matt said, sometimes it's just not really viable, you know, in a practical level.
although then you can relate that to the family instead.
Good. Other thoughts?
I'd be happy for them to keep it from me, but they just need to ask first.
Ask first,
So
yeah.
if they say, do you want to know a little bit about what's going to happen with your shoulder? And I say, not yet. So I'd be happy with them
Yeah.
keeping it from me as long as they were offering,
Yeah.
giving me the choice about whether I wanted to or not.
Yeah.
So I think that's that opportunity that we mentioned earlier.
Yeah, that's the key, I think, isn't it? Is to ask the person what their preference is, and do that collaboratively and respectfully in that sort of a way.